Let's discuss muscle cramps today. Almost everyone experiences a muscle cramp sometime or other in life. So let us go deep into the subject. It is the painful spasmodic and involuntary contractions of skeletal muscles. Skeletal muscles are under voluntary control, unlike the involuntary muscles like the heart, gut, and the bladder, and so on. Muscle cramp is an involuntary contraction of a skeletal muscle that does not relax for a while. The spasm or the contraction leads to severe, abrupt, unbearable, intense pain for a short while until the cramp subsides. During cramping, the muscle becomes harder and may even show visible signs of twitching. These cramps may last anywhere from a few seconds to a quarter of an hour or longer. These muscle cramps seem to increase with aging. It is rare among children. In older people, they are called rest cramps. These occur mostly at night. Sometimes they are initiated by making a movement that shortens the muscle. An example is pointing the toes down while in bed, which shortens the calf muscle of the leg, a common site of muscle cramps. These cramps are caused by hyperexcitability of the nerves that stimulate the muscles. There are many underlying causes of muscle cramps, but our discussion today is about the involuntary cramps you get with no disease causing factor. There is no underlying metabolic, neurological, or endocrine dysfunction. The commonest muscles that go into cramps are the leg muscles, feet, and your fingers. Such cramps could occur in your back muscles or even chest wall muscles, and you get a scare of a heart attack.
Get the finger. It's shy.
They do occur when you exercise or at rest, or sudden movements, or in the night time in bed. Dehydration, that is, not drinking enough water and fluids, is the commonest cause of muscle cramps, though most do not realize. It occurs when water intake is less than water loss. During exercise, you lose water, including magnesium, sodium, calcium, chloride, and potassium. Loss of the above electrolytes can cause mechanical deformation of nerve endings and increase ionic and neurotransmitter concentrations of the chemicals responsible for the transmitting of nerve impulses, leading to hyperexcitability of motor nerve terminals and spontaneous discharge of nerve impulses. Vigorous exercise can cause muscle fatigue, as is common among athletes. Numerous medicines can cause muscle cramps. Taking daily diuretic medication for high blood pressure and heart disease can lead to loss of water and electrolytes. For instance, with Lasix, a strong diuretic, you lose sodium and potassium. In all situations of a muscle cramp, stretching of the muscle seems to stop the cramp. So, if you get regular cramping, what should you do? A blood test to check your electrolytes and some minerals is the first thing you should get done with your family doctor. Older adults should have periodic magnesium blood levels if they use supplemental magnesium. This is because magnesium can accumulate in kidney dysfunction, which is seen in this age group, may lead to toxic levels of magnesium. So remember, lack of magnesium in your body and too much both can cause cramps. Deficiency in vitamin D, a vitamin required for the normal absorption of calcium from your blood, can cause cramps. Excessive levels of vitamin D in your blood can become toxic too. The upper limit of vitamin D daily requirement should not be more than 2000 international units with supplements. Diuretics are associated with an increased loss of calcium and magnesium, including electrolytes. These are given for hypertension and heart failure. If you get cramps with the normal potent diuretics, your doctor will prescribe a diuretic called hydrochlorothiazides. Diuretics cause sodium and most potassium depletion too. Older people seem to drink less water because the sense of thirst diminishes with age. This situation is exaggerated in those who are treated with diuretics. Several vitamin deficiency situations may directly or indirectly lead to muscle cramps. Vitamin B1, pantothenic acid, and pyridoxine are examples. When you walk, you may get cramping due to none of the above causes. It could be due to poor circulation to the leg muscles. This condition is referred to as intermittent claudication. The pain and the cramping is virtually identical to that of a severely cramped muscle. This may be due to accumulation of lactic acid and other chemicals in the muscle tissue. Be aware of this condition. Now, when it comes to treatment, most cramps can be stopped if the muscle can be stretched, especially for those ones in the leg and feet. Another way to prevent cramps in your legs is to stand about 2 to 2.5 feet from a wall and lean into the wall to place the forearm against the wall with the knees and back straight and the heels in contact with the floor. Another technique involves flexing the ankle by pulling the toes up towards the head while still lying in bed with the leg as straight as possible. For those young people who exercise, are recommended stretching before and after exercise or sports, along with an adequate warm up and cool down to prevent cramps.